Hello, I'm Mabel Jong, and you're watching Day 1 coverage of the World Healthcare Congress here in Washington, D.C., and I'm very pleased to have in the chair with me now Dr. Janice Nevin, who is CEO of Christiana Care Health System, the largest employer in Delaware. Welcome, Dr. Nevin.
Thank you so much for having me. Yes, largest private employer.
Largest private employer.
Delaware, yes.
So you touch a lot of lives, absolutely, in Delaware, and just by virtue of serving the people that you do in the community.
We do. We're a large community-based academic health center. We take care of all of the people in Delaware by virtue of the levels of service that we can provide. And also people come to us from the surrounding counties in Maryland, southeastern Pennsylvania, and South Jersey.
Okay, being so large, you really touch all aspects of healthcare, from addressing people's needs to really dealing with how to pay for that care.
Absolutely, and our mission has always been grounded in our service to the community. And it starts with being available to people when they're sick and they need our services, but it's also about keeping people well, keeping them healthy, allowing them to lead the lives that they want to live in a way that is successful for them and is also affordable.
Are you encouraged by the changes that the Affordable Care Act has brought about?
So I think this is the most amazing time in healthcare, certainly in my career, and I think much of the change would be happening anyway, just because there's so much pressure on the cost of care and the performance of how we deliver care. But it's very clear that the Affordable Care Act really catalyzed that conversation and created some new opportunities. In Delaware, we expanded Medicaid, and we provided insurance through the exchange. So we have significantly impacted the lives of people who were previously uninsured, and that's such an important first step in getting care. So in that sense, it's been terrific. I think also some of the innovation work that it has sparked through the Center for Medicare and Medicaid Innovation has also had an impact, and we've been able to take advantage and participate in several of those programs. Independence at Home, which is a program for the frailest of the frail elderly. The intent is to really put a team around that patient, an interdisciplinary team, to allow them to stay in the community and stay out of the emergency department, out of the hospital. That work has been very rewarding. We're in a Medicare Shared Savings ACO. What's exciting about that is we're partnering with two other health systems in the state, Bay Health and Nanticoke, as well as a very large federally qualified health center. So it's truly a statewide ACO, which is one of the opportunities that we have in Delaware because we're a small state. All of us who deliver care can roll up our sleeves and solve problems together.
Now, you've outlined some very positive developments. What has been more on the frustrating end? Are you happy with the speed of progress, or are you still feeling like we can move a little faster in improvement?
Yes, so the people that work at Christiana Care, my leadership team, would probably tell you that I'm going to answer that question. We're not moving fast enough. I think we've certainly picked up the speed, but again, there's such a great opportunity for us to actually do something that's fundamentally different in terms of how people get care. And what's really exciting is people can be healthier. You know, people with chronic illness can be healthier. People who, that top 5% that drives 50% of costs, there's a way for us to care for them that's value-based, that's comprehensive, that's different, that fundamentally will improve the quality of their life. The challenge is we've got to get paid differently if we're going to do that. So we can transform the delivery system, but at the same time we have to fundamentally change how we get paid.
Well, having been a practicing physician for a long time, you have very good perspective on how that might work. How would you change the paying system?
So I'm a family physician, and I've always looked at care in a very holistic way. So I talk about the biopsychosocial model. So it's really important, for example, that in as much as we pay attention to medical issues, we're also paying attention to those psychosocial issues. So a system of care that really helps patients address behavioral health issues, social determinants, allows them then to pay more attention to the medical issues. And so I've always sort of viewed health as being not simply just absence of illness, but really wellness, and an approach is needed that really embraces that. It's very challenging, though. In most environments, certainly in our state, we get paid on a transactional basis. It's volume-based pay. And because that creates certain incentives, and also means that some of those important psychosocial components aren't actually covered in the transaction, we've got some challenges. So the opportunity to do independence at home, to do Medicare shared savings, to do bundled payments, really starts to get us into a conversation that's more about the holistic approach of the care of a patient over a year, for example, or over their lifetime, as opposed to the individual transaction.
Okay. Now, Dr. Nevin, we've seen you speak at the conference before. What is your message that you really want to leave people with?
Well, I think I would come back to, there's so much that is exciting, and a lot of new innovation, great technology, new ways of doing things. But I always tell myself, and I tell my team and the people at Christiana Care, we've got to make sure we're paying attention to the people that we serve, that they don't get lost in this. And so I talk about what we do. It's very profound, but in some ways very simple, in that we take care of people.
All right. Well, we're going to leave it there. But actually, I do want to ask you, why do you make time for this particular conference?
This was a great opportunity to come and talk about the kinds of work that we're doing that I'm passionate about, but also to really network and learn from others. And I'm going home with a page of notes.
Excellent.
And some great new contacts, so it's been a good experience.
Great to hear. Thank you, Dr. Nevin.
You're welcome. Thank you.
And I'm Mabel Jong. Thank you for watching. More to come.